When closing a patient, you must take a direct and assumptive approach. Start the consultation with the attitude that the patient is going to begin treatment. One of the most common faults of anyone involved in selling is to talk too much and not notice that the patient is either closed or ready to close. Be observant to what the patient is telling you. If the patient starts asking you about how scheduling works, then they are ready to be closed. If the patient starts asking about what types of payment methods you take, then they are ready to be closed. Let's watch some examples of correct and incorrect closing conversations. This first example is an incorrect way to handle a closing conversation.
I think I need to take care of this.
It would be the best option for you. Do you need to think about it? When a patient agrees that treatment is necessary, do not give them an opportunity to overthink it and change their mind. Here is the correct way to handle this scenario.
I think I need to take care of this.
Yes, you're going to be very happy with this. I'm going to get you scheduled right now. Now, in this example, you will see an incorrect way to respond to a patient's concern about money.
This is a lot of money for me, but it's probably the right thing to do.
I know it's a lot of money. Would you like to give it some thought and let me know? The patient agrees that treatment is the right thing to do, despite their monetary concerns. Do not give them an opportunity to overthink it and change their mind. Here is the correct way to handle this scenario.
This is a lot of money for me, but it's probably the right thing to do.
I'm glad you see the value in this. Let's look at the schedule and see what day we can do this next week. Remember, whenever a patient agrees that treatment is the right thing to do, you should move to schedule them. Next, we will see another common mistake to avoid: overselling. Often you will see a treatment coordinator continue to sell after the patient has already agreed to begin treatment. Here is an example of overselling.
This is a lot of money for me, but it's probably the right thing to do. So let's just do it.
Yes, we can start by doing this procedure first, then you are going to have to wait a few months, and then we can do the next round of treatment. And if you want to speak with your spouse about this, that's fine. You can always just give us a call. You can see that everything that is said after they agree to begin treatment is extraneous information. Do not bring up subsequent treatments or offer more time for them to think about it with their spouse. Instead, here is an example of how to not oversell.
This is a lot of money for me, but it's probably the right thing to do. So let's just do it.
That's great. I'm going to have Helen come in and schedule you. I look forward to seeing you later this week.